Good evening, everybody. In today's lecture, we'll learn about blood brain barrier. Now, what is blood brain barrier? How the drug crosses the blood brain barrier and which drug crosses the blood brain barrier, we'll see in detail. But before understanding this, we'll see how normally the drug distributes in the tissues of other than the brain. So, we have the blood capillaries here. In the capillaries, we have blood. We have blood flowing in the capillaries. Inside the blood, we have drugs. We have drugs. We have various amino acids. We have nutrients present in the blood. Amino acids, and there are various nutrients present in the blood. Now, for the cells to take up these drugs and amino acids or nutrients, how it is taken by the cell. So, a tissue is composed of cells. Okay, the tissues is composed of a cell. Now inside before going in the cell is composed of the plasma membrane. The cell has the plasma membrane or the cell membrane. Inside the cell we have the intracellular component or the intracellular fluid, and outside the cell we have the extracellular component or the extracellular fluid, which is the outside the component. Extracellular means outside, intracellular means inside the cell. Okay, now this capillary, the wall of a capillary, is composed of various epithelial cells. Okay, this wall of capillary is composed of the epithelial cells. These are the epithelial cells. We have here extracellular fluid. Then we have the plasma membrane of the cell. This is the plasma membrane of the cell. Now, for the drug to reach inside the target cell, first, it will cross the capillary epithelial cell. Now, these drugs, which are of a size of 500 to 600 Daltons, what will happen that this drug will diffuse through the gaps between the epithelial cells. Okay, it will either diffuse through the gap between the epithelial cell, or it will diffuse through the epithelial cell. It will diffuse through the epithelial cell, or it will diffuse through the gaps present between the epithelial cells. Into from the capillary wall, it will diffuse into the extracellular fluid. Then once into the extracellular fluid, there is the plasma membrane or the cell membrane present. Here we have the intracellular fluid or the intracellular component. From the extracellular fluid, the drug will pass through the same mechanism. That is, it will either pass through the gaps between the cells, or it will pass through the cells, or the drugs which are having size greater than 500 to 600 Daltons, or the drugs which are polar, are taken up by the specialized carrier systems which are present in the plasma membrane. Okay, so this drug will bind to this carrier system and it is taken up into the cell. So this is a normal mechanism of the uptake of the drug into the tissues other than the brain. Okay, that the drug will diffuse through the capillary epithelium into the extracellular fluid. From the extracellular fluid, it will pass through the gaps between the cells or through the cells, or it is taken up by the specialized carrier system into the intracellular fluid or inside the cell. Now, what is so special about the blood brain barrier? Okay, as the name suggests, it is the blood brain barrier. It is the blood brain barrier. That is the barrier which is present between the blood and the brain. The barrier which is the present between the blood and the brain. Not every drug, not every nutrient can cross this barrier. It is very difficult to reach the brain. Okay, so This barrier is composed of four components. For the drug to reach the brain, or for the solute to reach the brain, it has to pass through the four layers. Which are those four layers? The first is the capillary endothelium. Second, we have the astrocytes and the pericytes. Then we have the basement membrane. Then we have fourth, which is the glial cell. Okay. Now we'll see the structure of blood-brain barrier. Okay. So first, we'll see the capillary endothelium. Now, unlike the capillaries present in the other body tissues, the capillary present in the brain, they are highly specialized. They are not the normal capillaries which are present in the other body tissues. Okay, they are highly specialized. How are they specialized? That the wall of these capillaries are composed of these specialized endothelial cells which are tightly bound to each other through the intercellular junction. We'll see in the structure. Okay, this is a capillary which supply blood to the brain. It is composed of the highly specialized endothelial cells. Okay, endothelial cells. So these are the highly specialized endothelial cells which are tightly bound to each other through the intercellular junction. Through the intercellular junction. These are the capillary endothelial cells. These are the tight intercellular, okay, tight intercellular junctions. Okay. Then we have the astrocytes and the pericytes. Now, astrocytes and the pericytes are the specialized cells which are present in the brain. These are present immediately after the capillary endothelium. This is the astrocyte. This is the pericyte. Mm. These are the specialized cell present in the brain. Okay, astrocyte. And we have the pericyte. Pericytes, specialized cells. After this, we have a basement membrane. We have the basement membrane here. These astrocytes and the pericytes are the elements of the endothelial membrane, and it will form a solid envelope around the brain. Then, after the basement membrane, we have glial cells. Okay, we have glial cells here. Now, there are two types of glial cells, that is the glial cells which are present in the central nervous system, and the glial cells which are present in the peripheral nervous system. So we'll see that what is the function of the glial cells. The glial cells present in the central nervous system are different, and the glial cells present in the peripheral nervous system are different. The glial cells present in this central nervous system, we have four types of glial cells. We have astrocytes, we have dendrocytes or oligodendrocytes. Oligodendrocytes, or we, and the third type we have is microglia, and the fourth we have the ependymal cell. ependymal cell. Okay, these are the four types of glial cells which are present in central nervous system, and there are two types of glial cells which are present in the peripheral nervous system. We have the Schwann cells, we have the satellite cells. Okay, so the if we see the normal functions of the glial cell, first to regulate the neurotransmission, first function of the glial cell. Second function of the glial cell, regulate the brain metabolism. Okay, and the third and the most important function, that it is the component of the blood brain barrier. Of the blood brain barrier. Okay, these are the three most important functions of the glial cells. Or of course there are many other important functions, but the three more important function is to regulate the neurotransmission, regulate the brain metabolism, and it is a component of the blood brain barrier. Then after the glial cells, we have the extracellular fluid. Finally, after the capillary endothelium, after the astrocyte, after the pericytes, after the basement membrane, after the glial cell, then we have the extracellular fluid over here. And then we have the brain. Here we have the brain. Normally, what it was happening, that for the drug to reach the cell of any tissue, of any tissue other than brain, it has to pass through the capillary epithelium, diffuse into the extracellular fluid. From extracellular fluid, it will pass to the plasma membrane of the cell and inside the cell. What is happening in the brain? This capillary which is supplying brain is also specialized in the sense that is having endothelial cells which are tightly joined to each other to the intercellular junctions. After that, it has the astrocytes and the pericytes, which are the specialized cells which form the solid envelopes around the brain. Then we have the basement membrane. Then we have the glial cells, which are different in central nervous system and peripheral nervous system. Then finally we have the extracellular fluid and the brain. So, for the drug to gain access, it has to pass through all these layers. Now, the capillary endothelium together with the astrocytes and the pericytes forms the blood brain barrier. It will form a solid envelope around the brain. These are the main components, that is the capillary endothelium, which are tightly bound to the intercellular junctions. The astrocytes and the pericytes form the solid envelope. Now for the drug to gain access, it has to pass through all these layers to reach the brain. Okay, so of course the drug to reach the brain, it should be lipophilic. Okay, it should be highly lipophilic. It should be highly lipophilic drug. If the drug is lipophilic, then it can easily cross the blood brain barrier. It can easily cross this blood brain barrier. Of course, there are many other polar drugs which still cross the blood brain barrier. How they cross the blood brain barrier? So, we have three successful approaches through which the drugs which are not lipophilic, or the drugs which are polar, are transported into the brain by crossing the blood brain barrier. So, we have three special approaches. So, in that, the first approach is that we can use the permeation enhancer. The example of the permeation enhancer is DMSO, dimethyl sulfoxide. Dimethyl sulfoxide. By using this, we can allow the drug, or we can improve the drugs, or can allow the drug to cross the blood brain barrier by using the permeation enhancers. Third approach we have is we can use the disruption. We can perform the osmotic disruption of what? Osmotic disruption of blood brain barrier. By how we can do this osmotic disruption of blood brain barrier? By infusing the internal carotid artery with mannitol. The internal carotid artery with mannitol. There is an internal carotid artery present. If we infuse this artery with the mannitol, then what happens? There is a osmotic disruption of the capillary endothelium, and also there is a alteration between the tight junction of the capillary endothelium. So what will happen, that the drug will have uh, increased permeability through the blood brain barrier. Then the third approach is that then we can use the dihydropyridine redox system. Okay, dihydropyridine redox system. This is very widely used. Dihydropyridine redox system is used as a carrier. Okay, it is used as a carrier. So this dihydropyridine is used as a carrier. So whenever there is a polar drug, we have a polar drug. When this dihydropyridine is combined with the polar drug, it will form a prodrug. Okay, it will form a prodrug plus polar drug, it will form a prodrug. So this prodrug will easily cross the blood brain barrier, and inside the blood brain barrier we have certain CNS enzymes that will oxidize this dihydropyridine into the pyridinium ion. So this pyridinium ion gets trapped inside the brain and it is not able to diffuse. This pyridinium ion gets trapped inside the brain and is not being able to diffuse out. So this mechanism is specifically used for transporting steroidal drugs uh, into the brain. So this is how the drugs that either the drug is highly lipophilic. If the drug is not lipophilic, then we can use certain approaches that we can link it with the carrier, that is dihydropyridine. Then we can perform the osmotic disruption. Osmotic disruption is particularly important. Mainly the chemotherapeutic drug follow this mechanism. They also cross the blood-brain barrier, and we can use certain permeation enhancers, specifically DMSO, that is dimethyl sulfoxide. Okay, then which drugs crosses the blood-brain barrier? Of course, it becomes obvious that there are various central nervous system disorders. So the drugs which cure, or the drugs which are used to treat the central nervous system disorders, will cross the blood-brain barrier. Which are the central nervous system disorders? Say if the patient is suffering from Parkinsonism, or if the patient is suffering from schizophrenia, or the patient is suffering from psychosis, patient is suffering from depression, and if the patient is suffering from any epilepsy, then in such a cases we specifically use the central nervous system drug. So it will have to cross the blood brain barrier to reach the brain. So some of the examples of such drugs are the antidepressant drugs. We have certain serotonin reuptake inhibitors. Examples are citalopram, escitalopram, fluoxamine. These are the examples of serotonin reuptake inhibitors that will cross the blood-brain barrier. Then we have tricyclic antidepressants. Yes, the examples of tricyclic antidepressant is amitriptyline, desipramine, imipramine, that will cross the blood-brain barrier. We have monoamine oxidase inhibitors. This is also used for the central nervous system disorder. Example is rasagiline, siligilin. Okay, this crosses the blood-brain barrier. Then we have the antipsychotics to treat the psychosis, like it is used to treat the schizophrenia and other psychotic disorder. We have the haloperidol. Haloperidol is a very important drug. We have the clozapine, which is again very important drug used in the for treating the psychosis. And we have first generation, second generation antipsychotic. Like we first generation, we have the flufenazine, uh, chlorpromazine, and then we have the uh, trifluperazine, ridazine, everything we have. And then we have the second generation, like the aripiprazole. So all these will cross the blood brain barrier. And then we have certain analgesic. So we have the opioid medications, including the morphine, oxycodone, codeine, and the fentanyl. So this will cross the blood brain barrier as well. We have certain anesthetics. So the anesthetics like the propofol and the ketamine are capable of crossing the blood brain barrier. Okay, these are the general anesthetics which are being used. So they act on the specific receptors in the brain, so of course it will cross the blood brain barrier. Then, as discussed, the drugs used in epilepsy. So main drug uses phenytoin crosses the blood brain barrier. We have valproic acid, we have the carbamazepine, which is used to treat the epilepsy, crosses the blood brain barrier. Dopamine agonist, mainly used in Parkinsonism. Now, if we give the patient suffering from the Parkinsonism, if we give him with the dopamine, then the symptoms are not reduced. Why? Because the dopamine does not cross the blood brain barrier. So, mainly, we convert this dopamine into the levodopa form. This levodopa form easily crosses the blood brain barrier. Inside the blood brain barrier, this levodopa gets metabolized to dopamine. Okay, and this dopamine shows actions. So this is how the Parkinson, in the Parkinson we have the levodopa. This dopamine gets, once get metabolized, it gets trapped inside. So this levodopa is used in a Parkinsonism, also crosses the blood brain barrier. We have certain anti-anxiety medications. Okay, anti-anxiety medications, mainly we have the benzodiazepines like diazepam, and we have the alprazolam. Yes, we have the alprazolam, and that has the calming effects in the patients who are suffering from the anxiety. Okay, and we have the cholinesterase inhibitors. These cholinesterase inhibitors mainly used to treat Alzheimer's. Okay, a very important drug in a patient suffering from the Alzheimer's. Example is a donepezil, rivastigmine. These cross the blood-brain barrier, okay, to increase the levels of acetylcholine in the brain. So they act centrally and crosses the blood-brain barrier. We have certain antiviral drug like zidovudin and penetrate. These zidovudin penetrate the blood-brain barrier to treat certain viral infections which are caused in the central nervous system. Yes, we have certain antibiotics, mainly the ceftriaxone, not in a much higher extent, but yes, some amount of the ceftriaxone do cause the blood-brain barrier. We have the meropenem, and we have the ampicillin, we have the amoxicillin, we have vancomycin, we have the linezolid. These are widely used drugs in hospitals, so these do cause cross the blood-brain barrier. Okay, for various infections cause. So this is all about blood-brain barrier and the drugs which cross the blood-brain barrier. Thank you.